So welcome to all of you. We're going to go ahead and begin our meeting here very, very shortly. First, we're going to be talking with Dr. Gillian Goobie, who is a MD, soon to be PhD, or I'll ask her when she comes on whether she already is. But she's already, yay, hooray. Yeah. Long haul for that girl. I know that. Yeah. So she's an MD PhD. She recently moved back home, I guess, home area, to Vancouver, British Columbia, and is just taken her first week on call as a pulmonologist in her hospital in BC. She recently wrote a paper, a very insightful paper in the Journal of the American Medical Association on the effects of small particle pollution on people with interstitial lung disease. And I'll let her maybe explain that a little better when she kicks off. So Gillian, you want to go ahead and do your presentation? I think you've got screen sharing ability. If there's anything that pops up with it, we'll try to help assist. So Gillian, please tell us about your work.
Thank you, Jonathan. Okay, so I'll just share here. 1 second. And you should be just seeing the slides and not the presenter view. Is that right?
Depends. Everybody has that choice, I think, Gillian. They can see you at the same time. So
yeah,
if they care to. But yeah, you can. Usually, you're a lot smaller than the slide.
Yeah. Okay. All right. So thank you so much for having me here. As Jonathan was saying, I'm a pulmonologist, or as we say in Canada, a respirologist, and I did all of my medical training in Canada prior to pursuing my PhD after my 5 years of residency here. And I did my PhD at the University of Pittsburgh in the School of Public Health there, where I was working primarily in the Department of Human Genetics and Environmental and Occupational Health, as well as with the pulmonary division there. So today I'm going to be talking about air pollution impacts on human health. And I'm starting a little bit more generally. I'm going to show you some of the kind of seminal papers and in different areas of air pollution epidemiology. I'll briefly go over some of my own research, and then I'll talk a little bit about mitigation strategies and what we can do for people who are exposed to air pollution, which is everyone. So I acknowledge with gratitude that I live and work on the traditional and ancestral and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So I've kind of discussed this already, but I want to talk about what we mean when we're discussing air pollution. What are the health impacts, both on all-cause and cause-specific morbidities and mortalities? Briefly discuss my research, and then we can talk about how people can manage their risk of air pollution exposures. So the criteria air pollutants that are regulated by the EPA through the National Ambient Air Quality Standards are listed here. And the gaseous pollutants are ozone, carbon monoxide, sulfur dioxide, and nitrogen dioxide. And then there's particle pollutants, which are PM10 and PM2.5, and lead is also regulated as a air pollutant. And the major sources of the majority of these airborne pollutants are industry, transportation, and agriculture. And this mixture of gases and particles can be inhaled into the lungs and can get into the systemic circulation and cause systemic issues. So PM2.5 is the air pollutant that I'm kind of most interested in my research, although I'm of course interested in all of it. But particulate matter with a diameter of 2.5 micrometers or less is what PM2.5 stands for. And it's about 1/50th of the diameter of a grain of sand. So you can see that on this graphic here. And what's important to understand is that PM2.5 is made up of a mixture of constituents that are really any particle that is at this small diameter that can be inhaled all the way deep into the lungs, into the alveoli, and depending on its composition can potentially be absorbed into the bloodstream as well. So the approach that I use for my air pollution research uses satellite-derived hybrid models that combine satellite measurements with ground measurements to break down PM2.5 into a number of constituents. And so the ones that I look at are sulfate, which is primarily related to steel and coal and other industrial production, as well as fossil fuel combustion. Nitrates, which are primarily fossil fuel combustion related. Ammonium, which is in industry as well as agriculture related. Black carbon, which is largely related to combustion sources. Organic matter, which can be combustion related, such as through biomass or wildfire burning. But it also can kind of represent more natural components of particulate matter that exist in the air, because some form of particulates in the air is something that has always existed and will always exist. So we have to know that there will always be some particulates within the air that just is a factor of living in a natural environment. And so this kind of encapsulates some of that particulate matter. Sea salt, also living by the ocean, like I do now, there's a higher composition of sea salt in the particulate matter. And then if you live in Arizona or New Mexico or other kind of desert type regions, soil particles are really made up of ground particulates. And then there's other non-classifiable particulates that we also can look at. So the big message that I want to convey to you is that PM 2.5 pollution and other forms of air pollution are massive global health problems. So the World Health Organization has recently set their ambient air quality standards for PM 2.5 recommendations to be less than 5 microgram per meter cube. The EPA standard is currently 12. And during episodes of really high air pollution, particularly like in the Pacific Northwest, when we're experiencing very high wildfires, we make it up to 100 or 200 even in particulate matter, just to put that in framing. And, some cities in the world, like, Beijing, cities in Beijing, Beijing, Delhi, other cities in India and China, can frequently be sitting in the 80, 100, even higher range of PM 2.5. So that just gives you kind of a frame of reference of where different places are sitting. And what we can see is that as PM 2.5 levels increase, the hazard ratio or risk for all-cause mortality increases quite rapidly as well. And then you can break this down on the right-hand side to cause-specific mortality. And so the risk factor for lower respiratory tract infection mortality, which is primarily deaths that we see in children, as well as the elderly. That is really affected up top. And then we've got ischemic heart disease in green, lung cancer in yellow, stroke in red, and COPD in purple. And recent studies have indicated that up to 8.9 million premature deaths per year can be attributed to PM 2.5. And that estimate is a little above what previous WHO estimates have projected. And so this is just a plot from the World Health Organization showing an estimate of the number of deaths in that have been projected. But what it's meant to show is just where that kind of distribution of mortality primarily lies across the globe. So of course we see in China and India that burden of number of deaths related to air pollution is the highest. But in the US, it's still quite a significant burden. There's quite a lot of attributable mortality to air pollution exposure in the US and across many other countries throughout the world. So it is really important for us to think about. So I'm going back to 1993, and I'm going to show you the Harvard 6 Cities study, kind of some of the main takeaways from this study in the New England Journal of Medicine. That was one of the first studies to really solidify a link between air pollution exposure and death in general populations. And so this was a study that was performed with people who lived in 6 cities throughout the US. So we've got Steubenville, Ohio, St. Louis, Harriman, Watertown, Topeka, and Portage. And what you can see on the left here is their total particle exposure. And then we've got fine particles, which are PM 2.5, and then sulfate particles. And what you can see is that Steubenville, Ohio, generally followed by St. Louis, and all of these plots, as well as Harriman, tended to have the highest exposures to particulate pollution, as well as particularly sulfate pollution. If you remember, that's largely related to industrial production, such of steel and coal, is what really produces a lot of sulfate. And what they found was that the cities that were exposed to the highest levels of particulate pollution, especially sulfate pollution, the St. Louis and Steubenville cities, had the worst survival, as shown on this curve on the right-hand side. And they looked at the adjusted mortality rate, which they adjusted for cigarette smoking and sex and age. And they found that the hazard ratio, comparing the least polluted city to the most polluted city, the most polluted city had about a 26% increased risk of death in general. And in terms of cardiopulmonary causes of death, about a 37% increased risk of death. So that was kind of one of the original papers that really showed this all-cause mortality risk. This is a 2017 study in the New England Journal that looked at about 61 million Medicare recipients and looked at ozone and PM2.5 impacts on mortality within this population. So this is just showing the distribution of PM2.5 across the US. And so you can see along the east that the PM2.5 levels are quite high. And then out west, in the southwest, that's where we see some of the highest levels of ozone. But for both PM2.5 and ozone, you can see that as the exposures to these pollutants increase, that the risk for all-cause mortality increases in a fairly linear fashion. So both of these particulate and gaseous pollutants do seem to be strongly associated with all-cause death. And what they found was that the PM2.5 mortality risk was highest in non-white individuals, as well as Medicaid-eligible individuals, so the elderly and individuals of Black, Asian, and Hispanic race, and then probably individuals of Native American race as well, although their numbers were smaller and resulted in wider confidence bands. And then they found that the ozone mortality risk was highest in Medicaid-eligible individuals. So I just wanted to go over a couple of cause-specific morbidity and mortality studies. And there's a huge amount of research that's out there. So I'm really only scratching the surface, but just for, broadening the scope a little bit here. So this is a study that basically was looking at a meta-analysis of the studies that have been performed looking at the risk of air pollution on hospitalizations in patients with COPD. And what they found was that looking at all of these studies, that higher exposures to PM2.5, nitrogen dioxide, and sulfur dioxide were all significantly associated with elevated risk of hospitalization for COPD. And there's also a lot of literature that indicates that COPD-related mortality and incidence of COPD is also substantially increased by exposures to air pollution. And this is becoming increasingly important, as well as we're kind of recognizing that our classical definitions of COPD have really missed a large swath of the population, because we, typically only think of it in people who have a history of smoking. But we really need to think about all of the inhaled exposures that people have had throughout the course of their lifetime. And not everyone who has COPD has smoked. And especially if you grew up in a country or in a place where you were exposed to a ton of indoor air pollution, let's say through wood smoke exposure, through an indoor wood stove, we're also seeing COPD that develops in people that have those sorts of exposures. So knowing about those environmental exposures that people have had throughout the course of their lifetime is really critical to properly managing them. There's a huge amount of research on air pollution risk and asthma. So in terms of asthma incidence, in terms of asthma exacerbations, even in terms of fatal asthma. So there's also a lot of molecular research that has looked at how air pollution actually modifies the airway hyperresponsiveness, genetic expression, as well as antioxidant expression, and actually the allergic sensitization in patients with asthma, and just risk of exacerbations themselves. So there's strong evidence for ozone, nitrogen dioxide, sulfur dioxide, PM2.5 as all being triggers for asthma, poor asthma outcomes. There's also strong evidence for association of particulate matter exposure with the incidence of lung cancer. So this study on this meta-analysis shows that the increased risk of lung cancer incidence with increased PM2.5 exposure. PM10 was also borderline significant. This is a study looking at PM2.5 and cause-specific cardiovascular mortality. And what you can see is that as you go from the kind of moderate PM2.5 exposure group to higher exposure groups, that the risk of all-cause cardiovascular disease mortality, ischemic heart disease, and stroke is significantly elevated. I'm not exactly sure what falls into this other category, but I guess it's all other cardiac comorbidities. There's also good data for the risk of ambient air pollution and ischemic and hemorrhagic stroke. Unfortunately, this study didn't have any beautiful figures, but they found that there's higher short-term and long-term exposures to air pollution that are associated with increased risk of ischemic stroke. That this risk is highest in people with pre-existing cardiovascular risk factors, that short-term exposures may be associated with increased risk of intracerebral hemorrhage, and long-term may be associated with higher risk of hemorrhagic stroke. And, even dementia. Several studies have demonstrated for multiple pollutants that increased exposure to these pollutants are associated with dementia and cognitive decline. So this is just showing the number of studies that have demonstrated on the right-hand side an increased risk of these two outcomes, the incidence of these outcomes. And type 2 diabetes. So this is from the Global Burden of Disease study, and they found that as outdoor air pollution increased, particularly looking at PM2.5 here, the relative risk of type 2 diabetes incidence also increased quite significantly. It appears to have a plateau point as you get past about 50 microgram per meter cube. And lastly, chronic kidney disease. There's been increasing evidence to indicate that CKD there's an increased risk of CKD incidence as PM2.5 and nitrogen dioxide levels increase, and that this is persistent with several year lag times, going from 1 to 4 year lag times for PM2.5 and across various lag times as well for nitrogen dioxide. So another question that also arises when thinking about these studies is what other environmental factors aside from air pollution may intersect with these outcomes, and how do we evaluate that? So in my research, I looked at the Area Deprivation Index, which is a measure of neighborhood level disadvantage and acts as a surrogate for socioeconomic status. And this is based on 17 different metrics of material and social deprivation, such as access to education, transportation, social supports, number of people within a household, those sorts of factors. And I used a Canadian equivalent as well, which was a Canadian Index of Multiple Deprivation, which looks at similar features. And this is just showing the ADI across Pittsburgh. So you can see the least disadvantaged areas and the most disadvantaged areas in red. And you can see that across Pittsburgh, there's quite a variation in the amount of disadvantage. And, we can talk about historical factors that contribute to that, such as historical redlining and other racist institutional practices that happened in the past. And another thing that is important to note as well, I've just starred here the top industrial polluters in Allegheny County. And you can see just from looking at this map that the highest polluting industries within the region also tend to coincide with the most disadvantaged areas. So you can imagine that the people that are living in these regions are probably exposed to higher levels of risky airborne pollutants. And this is a beautiful study by Bo et al. In JAMA Network Open from 2019 that shows this very well, and also looked at the area deprivation index in the general population. And what they found was that as your disadvantage increased, so the ADI quartile 4 was the most disadvantaged group, your risk for PM 2.5 associated mortality also increased significantly. And they also found that Black individuals as compared to non-Black individuals had the highest risk of PM 2.5 associated mortality. So I'll just briefly touch on my research looking at the environmental impacts in patients with fibrotic interstitial lung disease. So fibrotic ILDs are a group of over 200 pathologic entities characterized by scarring of the lungs, as well as shortness of breath, cough, and progressive respiratory failure. The most common form is idiopathic pulmonary fibrosis, which has a median survival of 3 to 5 years from the time of diagnosis. So these are very severe conditions. And we know a lot about the genetic risk factors. We know that smoking is a risk factor, and there's been tons of research in those areas, but little is being established in terms of environmental risk factors for the development of these diseases. So this is the first kind of manuscript from my PhD looking at how neighborhood disadvantage impacts outcomes in these patients. And we compared the US cohort of patients primarily from the Pittsburgh region with our Canadian cohort of patients with fibrotic ILD. And what we found was that the patients that lived in the highest quartile of disadvantage in the US cohort had about a 51% increased risk of death as compared to patients that were in the least disadvantaged quartile. And interestingly, we did not see the same effect in the Canadian cohort. And this is not to say that, disadvantage doesn't exist in Canada, because it very, very much does. But it raises questions as to what is the cause of this discrepancy between, does disadvantage actually increase your risk of death when you have interstitial lung disease? And one key difference is the presence of a universal healthcare system in Canada, of course. And then another difference may be the intersecting factors of air pollution and other environmental exposures. So just not diving into this anymore here, I encourage you to read the article if you have some more questions about this, because there were a number of other analyses that were performed as well. And then our more recent study in JAMA Internal Medicine looking at how PM 2.5 pollution impacts patients with fibrotic ILD. This is our spread of patients across Canada and the US. We included about 6,600 patients enrolled from all of these sites. The Simmons Center from Western Pennsylvania in yellow, the Pulmonary Fibrosis Foundation in blue, and the Canadian Registry for Pulmonary Fibrosis in red. And what you can see is this is projected on the PM 2.5 annual estimates for the year 2005 using our satellite-derived hybrid model approach. And you can see the distribution of PM 2.5 varies depending where you are. And I've just highlighted a couple of hot spots as well that are areas of wildfires that occurred in this year. And so it's really interesting because it picks up a lot of regional variability that is not typically appreciated by ground-based monitoring systems, such as that's picked up through the EPA, for example, which are ground-based monitors that tend to reside in the highest population regions. So for people living in rural and remote areas, we may not be adequately appreciating what their exposures are. So using satellite approaches actually allows us to pick that up a lot better than traditional techniques. And what we found was that we got our Simmons Center on the left, the US-wide PFF in the middle, and the CARE-PF on the right. Our Simmons Center from primarily Western Pennsylvania, we found that almost 50% of their total PM2.5 exposure was comprised of anthropogenic or primarily human-derived constituents, so sulfate, nitrate, ammonium, and black carbon. Whereas our Canadian cohort, only about 25% of that was made up of those human-derived constituents. And that the exposures to PM2.5 were highest in our Simmons Center cohort and lowest in our Canadian cohort. We found when we used the American Thoracic Society recommended 8 microgram per meter cube cutoff of low versus high PM2.5 exposure, that patients with high PM2.5 exposure across all 3 cohorts had a higher risk of death in analyses that were controlled for relevant covariates of age, sex, race, smoking history, and neighborhood level disadvantage. And what was interesting was that the spread of the curves was much more profound in the Simmons Center cohort, and the hazard ratio here for high exposure was about 4.4, whereas there was a significant association in both the PFF and the CARE-PF cohort, but the hazard ratio was substantially less, about 1.45 for the CARE-PF cohort. So we were really scratching our heads as to why this was occurring, but then we remembered that the distribution of PM2.5 composition was quite different between these cohorts. And when we looked at the primarily human-derived constituents of sulfate, nitrate, and ammonium, we found that there were much more similar effect sizes across the board, and that these were all consistently associated with increased mortality at high exposure levels. So for example, the hazard ratio for high exposure to ammonium in the Simmons cohort was 6.5, and in the CARE-PF cohort was 5.11. So a much more similar effect that was estimated there. And I encourage you to go to the study to read this a little bit more, because there's a lot more details that are in the study, but for the sake of time, that's kind of all that I'll go into today. And I'll just address that my future research is really looking at the molecular mechanisms of how PM2.5 actually exerts its harmful effects in patients with fibrotic ILD. So looking at gene-environment interactions, DNA methylation, and other epigenetic changes, telomere length and senescence pathways, and oxidative stress and inflammatory pathways. So we've got a number of different ongoing projects looking at that. And I'm going to finish up here just by talking about what people can do to mitigate the harmful effects of air pollution. So one of my mentors, Chris Carlston, wrote this excellent review in ERJ in 2020, talking about the different mitigation strategies. So there's household and ambient air pollution mitigation strategies. So for example, in your household, you can better ventilate the home. You can have electric stoves rather than gas burning stoves. You can install air purifiers, but of course, all of that comes with significant cost burden and probably is not accessible to low income and disadvantaged individuals. Other mitigation strategies when you're outside, you can consider wearing a 95 face mask, which do prevent some air pollution exposure. That would be something that you may want to think about in really high pollution days. You know, if you are in a wildfire prone area and you're in the midst of severe wildfire season, or if there's an air quality alert related to excess industrial pollution, those are things that can be considered. And then other considerations in terms of, you know, just being able to monitor your air pollution. There's a whole bunch of different applications that are available now where you can monitor it. And it is something that we've started to talk to our patients about a little bit more. There's also questions about different effect modifiers. So smoking cessation, of course, is always recommended. There's questions about whether different diets have an effect modification on people's risk of air pollution adverse outcomes. And then there has been research into medical therapies to prevent the adverse impacts of air pollution. And then, of course, our recommendations are modified for people that are at the highest risk of adverse outcomes from air pollution exposure. So that's the elderly, children, pregnant women and their fetuses, and people with underlying cardiopulmonary disease. This is another study or review by Kevin Cromar and Robert Lombach, which is really just showing that as you go up from, really targeting the source to preventing air pollution exposure at the individual level, you also really increase the burden on the individual and the risk of unintended harm from the intervention. So we should be really targeting a reduction of the sources of airborne pollution, and that comes through regulation and decommissioning of highly pollutant sources. And then as we go up, staying indoors, decreasing physical activity, these have really significant impacts on people and their quality of life. So we need to think about that if we're recommending this to people. So another thing that you can do is you can advocate for clean air. So talking to your elected representatives, joining community advocacy groups, joining professional organizations that advocate for clean air, like SPAN Ohio. Like for myself, I'm a part of the American Thoracic Society Environmental Health Policy Committee, and our committee has done a number of things to advocate for clean air. So here, we were liaising with the White House for the Biden administration Justice 40 initiative, which planned to allocate 40% of climate and environmental investments to the most disadvantaged groups in the U.S. We provided our input as the ATS on the methane rules considered by the EPA, on the PM2.5 National Ambient Air Quality Standard reassessment, and on the ozone reassessment. And then, one of the ones that we're most proud about, even though it didn't turn out very well for the Environmental Protection Agency in the end, was this amicus brief that we wrote with the Georgetown Environmental Law Group, really supporting why we think that it's critical that the Environmental Protection Agency be able to regulate greenhouse gas emissions and the potential human health impacts related to climate change and air quality. And so, I think that there's a lot that you can do to get involved. And I really want to promote all of you to be strong advocates for that, for yourself, for your patients, for your loved ones. And I'll leave it at that. And I've got a huge number of people to thank for all of the research that I've done, that they've helped me with. And of course, all of the patients that have contributed their time and their information to being a part of research that's been enormously helpful for us. And I'll
wow, Gillian, thank you so much. Incredible amount of information there for us to digest. But I mean, maybe I'll just simplify it. I mean, it's very clear air pollution is bad for us. We have something called the Environmental Protection Agency. Let them protect the environment, right? Yeah. But no, the Supreme Court didn't want to do that. I mean, it's exactly the sort of stuff that makes me want to tear my hair out, what's left of it. And again, one of the reasons we invited you, actually the trigger for some of these conferences was a couple of those recent Supreme Court decisions that were just beyond comprehension. Yeah. Reversing the decades-long precedent of women's right to protect their own bodies and make their own choices about carrying through a pregnancy. Yeah. Then the air pollution, and we're going to go on to talk a little bit about another problem that's very pertinent, kind of in that red area that you showed with air pollution. These are the fracking areas too that we're dealing with, and maybe I'll ask you, as taking advantage of this before we move on to our next speaker, to speak about that. And if you can stay on, we'd love that, because we're going to try at the end to have additional questions. So, sure. But I'm curious about, with fracking, what the air pollutants are that are released when they're doing that. My understanding is there are all kinds of volatile gases that are part of that. There's got to be some leak into the atmosphere. Has that been studied at all?
It definitely has. I'm not an expert in that area, but I do know that lots of volatile organic compounds. And then I think a fair bit of nitrogen dioxide as well. My colleague Jim Fabizak from Pitt is doing a fair bit of research in that domain, looking at fracking and I think asthma outcomes in proximity to areas where fracking is occurring at large scale. So, I think that there's early research that supports that there's potential significant human health impacts.
All right. Boy, I mean, it's very frustrating for us here in America that the Environmental Protection Agency has been kneecapped a little bit here. And it's time for us to, those of us who care about healthcare, who care about our own health, to fight back. So we're going to move on to our next speaker. And I'm going to go ahead and do a quick introduction here. Our next speaker is Bill Lyons. For those of you that saw another name on there earlier, sadly, Professor Ouch was unable to join us, and we had to hustle a bit, but we've got an excellent environmentalist to speak to us on the issues around fracking and specifically the use of fracking brine to de-ice streets. And what is that doing when we're pouring this stuff out into the environment on our streets to use as a de-icer? So this is Bill Lyons. He's a co-organizer of the Columbus Community Bill of Rights, a group that's working to protect water in the Columbus metro area from toxic and radioactive fracking waste. And Bill is president of the Ohio Community Rights Network, and is working to educate, empower, and motivate Ohioans to build equitable communities, to secure the right of democratic local self-governance, and to establish the rights of nature to exist and flourish throughout Ohio. So, Bill, are you on there? Can we switch over to you? Make sure you're unmuted at this point.
Yes, I'm here. Can you hear me?
There he is. Hi, good morning.
Good morning.
So did I miss anything you want everybody to know about you and your work?
No, I guess I'll get to it probably as I speak a little bit more about some other things we've done there. So,
well, you're free to launch.
Okay. All right. So, yes. Well, thanks for having me. Yes, Ted Auk was Frack Tracker was supposed to do this talk, and then I guess he couldn't do it. So Bob Grayson asked me to do it. And so I said, sure. We've been active, Ohio Community Rights Network, about this issue of brine also. So I wrote an article, and I'm going to refer to that, and then I will share my screen with some things that I want you to see, but I haven't prepared a PowerPoint since I just found out I was going to speak in a couple of days ago. But first of all, when they drill for oil and gas, whether they drill what's called the conventional way, which is just vertical wells, or the unconventional way, which is they drill vertically, then they drill horizontally, sometimes for miles, there's a byproduct that comes back up. And in fact, the volume of it is usually much more than the oil or the gas that comes up. And they call it euphemistically brine because it's very salty. And so there's ancient seabeds because the earth has changed over all of the billions of years that it's been around. And not only this, some of this water comes back up, but also some of the water that they use and chemicals and other things to inject into the wells. And we usually refer to the horizontal wells as frack wells. In fact, they're all fracked, but the volume of water that's used and since it's really taken off in around 2008 or so, fracking, what we call fracking is more the unconventional or the horizontal wells. So the industry, it's been estimated that they produce or is produced from their production of oil and gas. There's about this byproduct, about a trillion gallons of this so-called brine. Again, it's really toxic and radioactive oil and gas waste, and we'll talk more about that. So the industry is like, what are we going to do with this stuff? Well, one way they get rid of it is they inject it into wells, into class 2 wells. Ohio has 226 of those. And Ohio, not only we inject our own waste into those, but we take waste from Pennsylvania, West Virginia, and even other places there. So we're kind of the dumping ground of it. And the belief is that, well, it just stays down in the ground and it will never come back up. But as we've seen just last year, that there was a well, and there's been other examples where because of the huge pressure that they use, and the ground is full of seams and holes and things, it came up through other abandoned wells. And there's many abandoned wells, and many of them, we don't know where they are in Ohio. So it's just like a pinhole cushion in a way there. So a lot of this brine came up. But so we want to talk more about what else do they do with it? Well, because it's very salty, they say, well, we can use it to melt ice, and then we can spread it on roads also as a dust suppressant. Well, the problem is that it contains much more than salt. In fact, it's got heavy metals, cadmium, arsenic, lead, mercury. It's got toxic or volatile organic compounds such as benzene, toluene, xylene, and so forth. And most alarmingly, it has radium-226, 228, and even some other radioactive nuclides. And in fact, it has them in high concentrations. And we know this from a study. Well, the oil and gas industry has known for about 100 years that this brine is radioactive, but most of the general public hasn't known this fact. And most of them maybe still don't because they still call it brine. Well, just to show you maybe I'll share my screen here for a second, that let me just pull this up here. Okay, so let's see. Can you see this screen here? Right. Okay, so what this is a study that was in 2017 to 19 that ODNR did on wells throughout Ohio, and they looked at the concentration of radium-226 and radium-228 in combined. Okay, and then they looked at this from what they call conventional brine and horizontal brine, and even some out of state there. So you can see the numbers are very, very high. Well, what's allowed by the EPA, not to say that it's safe, is that in our drinking water, this is a measure of what's called picocuries per liter, and in our drinking water, what's allowed is a combined total of 5 picocuries per liter. Now, for some reason, what's allowed to be discharged in the environment is 60 for radium-226 and 60 for radium-228. So look at these numbers. Only one well just barely passed there, as 60 was 226 and 6 for 228 there. So this was just a sample, and like I said, there was 100. So I'll stop sharing the screen here. Let's see. Whoops. Let's see. Where did I stop sharing? Yeah, there it is. Yeah. So I'll come back and I'll share my screen some more. So this was ODNR's own study of this, the Ohio Department of Natural Resources. Okay. So let me go back. Whoops. So now, what's the problem with radium? Well, first of all, radium is water soluble, it's bone seeking, and the half-life of radium-226 is 1,600 years. So it's only going to be half as radioactive as it was almost 2,000 years from now. So that means it's going to be around in effect many generations there. Even low levels of exposure can cause bone, liver, breast cancer. Another problem with radium is it decays into radon gas, which is the second leading cause of lung cancer. So it's a big problem, and you can see the brine from all these wells is way beyond that there. And also, if you want to read much more on the fact of this, there's an article in Rolling Stone magazine written by Justin Noble called America's Radioactive Secret. If you look at that, that has a lot of great detail in it. All right, so what has been done? Well, let me give you an example of what, like Morrill County, which is north of Columbus there, but we're downstream and it's in our watershed area. In the 60s, they had an oil boom, and Ma and Pa wells, not just big ones, started drilling there. And so what happened is they got all this brine also, and they started just spread it on their lands. Well, what happened? It seeped into the ground and it affected the groundwater, so that I don't think anybody in Morrill County can use their well water because of it. And here it is, that's almost like 60 years later. So it shows you the one of the detrimental effects of using it. So what all has happened with this? Well, since it's radioactive, one of the things that we say, well, shouldn't it be processed as radioactive waste? Well, in 1988, with heavy lobbying by the oil and gas industry, the EPA, which we say we ask them to regulate, but the job that they regulate sometimes is not really in the public's interest. They declared oil and gas waste as non-hazardous, so they don't have to regulate it as radioactive waste. Now, the oil and gas brine, like I said, has been spread various places in Ohio probably for many decades. But in 1985, there was a bill passed in the state of Ohio that legalized the practice of oil and gas brine spreading, but they had to report on where and how much, and so at least some kind of measure to keep account of it. Well, 1 year later, in 1986, it was, and Ted Celeste was the governor then, that it was discovered that benzene, they didn't know that benzene was in brine, and high levels. And so there were articles that I did some research, and I found out that it was a big alarm in 1986. And there was talk of the Ohio EPA, the Ohio Department of Natural Resources, and the Ohio Department of Health are three agencies that we look out for our health and safety and our environment. They said that, well, we're alarmed by this, benzene's a problem, and we think that this practice of brine spreading should be stopped. So brine is spread not all over Ohio, but anywhere you travel, you can be exposed to it. So let me just say about that, and then I'll come back to what happened since 1986. Well, a lot of townships, counties use oil and gas brine. So when you hear the term brine, you have to kind of be careful. Where does it come from? Is it from just mixing rock salt and water? And then sometimes they add other things like beet juice and various other things they add to it. Or is it coming straight from the oil and gas waste, which they call brine? So a lot of places, they don't know what brine, and you see those trucks spraying that. Well, to be spread in a county, the county commissioners have to approve applications of it. And so businesses can even apply to spread it on their roads or their parking lots or whatever. And the the Ohio Department of Transportation was spreading it on some highways in Ohio, and the Ohio Turnpike Commission was spreading it. And they were buying a product called Aqua Salina, which is basically oil and gas brine, but it's been processed in a way, but it doesn't remove any of the harmful products of it. It just made it clear, and then they color it blue, and then they sell it. And it was bought by them. And after pressure from many people who are looking out in this issue, they decided they're not going to purchase any more of it a couple years ago. I don't know if they're actually spreading other oil and gas brine waste, but they aren't buying this product that they were spreading. So what happened in 1986, then they said that they were going to lobby the legislature to ban this practice. Well, nothing happened. And here that was 36, 37 years ago. So then this study came out, but it should have been known long ago, like I said, from ODNR in 2017 and 19, that it's full of radium. And of course, the industry has known that fact. So just to give you an example of some counties and also township trustees, if it's in a township, they can also approve, but a business or has to apply every year to renew, to get a renewal of its application if it wants to spread oil and gas brine on their facility. So some places it's being spread in Ohio and some places it's not. I thought that it wasn't being spread in Franklin County, where I live, because I'm from Columbus, but found out through Teresa Mills that there was a facility in Gahanna, which is in Franklin County, that was spreading it. So I contacted the Franklin County commissioners and let them know about how dangerous this is. And they decided to not renew the application of that facility after they've been renewing it for many years, and passed a resolution to say that they don't plan to approve any future brine spreading applications. And the same thing has been passed in Athens County, but only these two counties have passed any. Now, some haven't approved it at all and spreading. So there's a map that I had asked Ted Auk, who was supposed to originally give this talk, to create a map to show where this is being spread. And I'll share that with you. And it's also in my article, which I will put the link to. And I'll just show you. So he asked me then to write an article about it. And in that article is the map. So you can see in this map, and you can search it, and you can find in here, for instance, if I were to click on one of these places here, then it'll tell you the township here within the county here, and then it will show you, and you can scroll down like how much brine is being spread or has been spread. And then there's some arrows to find out more information there. So you can see kind of where much of it has been spread. It includes other things this map does. But that's one place where you can get information. Okay, so let me go back to what has happened about this fact, that those of us and groups who've been alarmed by this practice of spreading this toxic and radioactive stuff on our roads there and jeopardizing people and nature, said, well, wait, why is this still happening? It was bad enough when they saw that it had benzene, and now we know it has high concentrations of radium. So what does it take for this to stop here? Well, it got even worse, because in the past 3 legislatures, a bill has been introduced, and it's basically been pushed by the owner of a business that makes this product called Aqua Salina, which is, like I said, it's so-called processed oil and gas brine that is, they just take I think the oil out of it and then color it a blue color and then sell it. But it still it's been tested, has all the radium and other things that they promoted 5 bills in the legislature. And the fact that they even get hearings on these things is kind of crazy. That is let's see, let me find it here. It would basically allow them to sell this stuff, basically this processed brine as a commodity on the shelves next to Roundup or other things or rock salt, as if it's the same as just rock salt. And then it could be spread on your driveways and you can track it into your homes and your pets. And at some point, several years ago, it was sold in Lowe's stores in I think Northeast Ohio, and people were alarmed, and then they took it off the shelf. And then I think some law was passed to make it harder to do that. So basically, they've been allowing this one person for the benefit of this company, to have this bill to get hearings, and alarmingly, with no warning about the radioactivity that's in the bottle and all the other harmful things, to try to get that. And it would authorize, get this, it says in the bill, and you can read it, Senate Bill 171 from the last legislature, and House Bill 282, it would authorize levels of 20,000 picocuries per liter for radium-226 and 2,500 picocuries per liter of radium-228. And remember, I said 5 is what's allowed in our drinking water, and 60 of each is allowed to be spread in the environment. And it's just unfathomable that such a thing was even considered. It's even considered. So what has happened also is that the Ohio Community Rights Network, at first we found out that there was a law on the books, that Ohio Revised Code law that was enacted shortly after 9/11, that makes it a felony to knowingly leave in any public place or knowingly expose one or more persons to any hazardous chemical or radioactive substance with the intent to create a risk of serious physical harm to any person. Well, we argue that elected officials and state agencies have long known about the danger of this, but they still allow it to happen. So aren't they violating this law? So what we did, and we drafted a letter, and here I'll show you the letter here in a second. Okay, so let me share my screen with that one. Okay, so here we go. Okay, so we sent this just after they came back for the lame duck session. In fact, the day they came back, November 15th of last year, because we wanted to try to prevent, if they were going to start hearings again, or try to even just pass these brine as commodity bills, where they would allow the selling of this product on the streets. So we sent it to the governor. We sent it to the state agency directors there, ODNR, ODH, Ohio EPA. We sent it to the President of the Senate, the House Speaker, and then the representatives of the committees that were holding hearings for these 2 bills that I mentioned. And then Mary Lightbody, because she had introduced a bill earlier last year, House Bill 579, that would prohibit surface applications of brine from oil and gas wells. So we also had a press release, and we sent it to, of course, there was a lot of shenanigans, as we know, going on in the lame duck session. So we didn't get really any press coverage. But one thing that did happen is Mary Lightbody's bill did get its first hearing. So maybe our letter had an effect. Now, our letter talks about the fact that why have they not done anything since 36, this must be stopped. 36 years ago, they talked about banning this stuff here. So we had 28 organizations with 27 plus us sign on to the letter there, and Span, Ohio, as you can see, was one of them there. So we thought that was great support there. And also that we had a press release that, so let me pull that up here. So let me just share that here too. And that's what we sent out to the media as well. That we called it Back to the Future, Ohioans Still Poisoned After All These Years. And so that's what we hope to get coverage. So we're not done with this. Well, I'm sure we'll continue to have more actions on this. As another place where you can find information about this, you can go to our webpage is one. So let me share that. And it is, okay. It's the Ohio Community Rights Network page, ohiocrn.org. And we have a tab called Toxic Trespass. And so with that, we've got our letter you can click on there. We've got our press release here about that. We've got many, many other articles. Now, these right here are articles just to show you what I was talking about in 1986. So here's one that talks about how state health agencies, environmental agencies will seek legislation to outlaw spreading of oil and gas brine for ice and dust control in Ohio. Like that, you can see that's from 1986. Let me just pull up one more here. That's so the environmental surprise of 1986 in Ohio just might be a toxic potion called benzene and brine. So, so they were so concerned of it back then, but nothing has happened since then, and they even considered making things worse. So you can find out more about on our page here. There's the bills there. And then here's some of the coverage we got previously about this topic here. So I guess that's the crux of it there that I wanted to say. Now let me just show you the article that I wrote that you can also refer to and find more information in that there too. So there, oil and gas brine in Ohio. This is the Frack Tracker article that you can read, and it's got many links about some of the things that I mentioned there. And there's the map that you could click on and you could search if you want to see if it's being spread. But just even if it's not spread where you are, what about when you travel somewhere? Mm-hmm. And then plus, if it gets into our water doesn't stay in one place, as we know. So anyhow, I think that I'll stop there and then we'll welcome any questions when we have.
Wow. So one of the things I'll take advantage of being the moderator to ask a straight up question, whether we actually have anything that tracks the number of gallons of this stuff that have already been put into the environment in our state, because we're talking about radium, which has, as you pointed out, almost a 2,000-year half-life. It's going to go into our bones. It's going to be with us. It causes all kinds of other dangerous effects. So I don't know whether anybody's actually tracking the total quantity, because my guess is if you took a trillion, did you say 1 trillion gallons of stuff?
Yeah, in the U.S. and in Ohio, I think that it's billions of gallons have been injected into injection wells, and millions of gallons, and I don't know how many millions, but have been poured on our roads. In fact, Pennsylvania doesn't allow it right now.
Yeah. I mean, to me, it's just, the height of negligence on their part. And I don't know whether we have legal aid lawyers or people like that, environmental lawyers who are working on this, but holy smoke, we should be going after them. And if it turns out that there is evidence in the long run that this stuff has clear and present effects on health. We could guess from benzene, which causes leukemia, and from radiation, which causes cancers of all sorts, that we're just asking to increase the malignancies and deaths from it. So I'll shut up here. NJ or Deb, who's moderating the questions? And let's let it go right now. Gillian, are you still on?
Yeah, I'm still here.
Okay.
Right, thank you. Thank you for.
I'll monitor questions, and we have a question from Tim Bruce. When you're called on, please unmute, ask your question, and then remute.
My question is for Bill. I'm particularly concerned with geothermal energy. It's an up and coming non-polluting, that's not producing any greenhouse gases. And they use a technique that is similar to fracking, that is that they inject water into the ground that is then heated and then brought to the surface and used to drive turbines. And I just wondered whether that technique would have the same kind of pollutant as the fracking that you're talking about.
I have to admit that I don't know much about that. It'd be interesting to look at that fact, but yeah, that's not something that I've ever heard anything about or know anything about personally.
Yeah, I know, Tim, Iceland uses primarily geothermal energy. Maybe they would have some lessons for us on that, your question, and that we can take a look there.
Well, okay.
Yeah.
There's a particular technique that's very similar to fracking that is not what's used in Iceland, but rather, can be, and there are various sites. I know there's some in California where they are generating electricity from thermal sources by using this fracking method.
That's interesting. Well, I think one thing that makes what's the so-called fracking worst, well, I don't know how it compares to that, is because they look at the shell layer is where they get all of the oil from, but shell is also collects all of the toxic materials because it's like a Brita filter that's been around for millions of years or longer. So I think that's why what comes back up is so much toxic things, but maybe also some of the similar things come back up in the process you're speaking about. I don't know.
Okay, Dee Chavez has her hand up. So.
Okay, thanks. I just want to say thanks to Gillian and Bill for the interesting information. And I mean, you hear a lot about these things, but this is really detailed and I appreciate it. But I have kind of a two-part question for Bill. So you mentioned that after 9/11, an Ohio Revised Code, something was passed. What does that do? And it said that you can't knowingly use harmful substances. And if you could just expand on that. And then the second part of the question is, what is it that Mary Lightbody, did she try to bring a bill against this, or what? I didn't miss what you said, what part she played in that.
Okay, sure. Well, the law is Ohio Revised Code 2927.24. And like I said, it was enacted in 2002. So it's also mentioned in my article there. So I can put the link to it in there. And then also it has a link to our toxic trespass page and all that. I can put that in the chat there. But it was because of the concern for terrorists after 9/11, putting radioactive or hazardous substances in our water. Well, we just find it ironic that why do our own state legislature and agencies allow this stuff to be that's going to ultimately, if it, and I'm sure it has, seeped into our water. So that's why we say that, well, look, there's already a law, and why aren't you concerned about obeying that law? We look to what happens on the outside, but what about what's happening on the inside? And Mary Lightbody's bill, yes, it is basically just to call for a ban of this practice of brine spreading in Ohio once and for all, House Bill 5. But she's going to, like I said, it got one hearing during the lame duck session, but she's going to reintroduce it. She plans to this year.
House Bill what? That was
it was 579 if you search for the legislature from last year. Yes. Yeah. And there's a link to it also.
Okay.
Article as
Thank
well.
you.
Mm-hmm.
Okay, we have some questions that are in the chat. Bill Davis wants to know if there is satellite imagery available to locate areas with high radiation levels. And Marilyn Webster has asked if maybe Bill can send references or put them in the chat. And then we'll follow up with a question for Gillian. Are there any good PM 2.5s? For instance, can sea salt be beneficial to inhale? And then Bill Davis put in a link about geothermal energy in that. So let's start with the satellite imagery.
I'm not sure about that. Maybe Dr. Goobie knows about that there, if there is.
I don't know. That's a really interesting question. I was just thinking about it. My limited knowledge of testing for radiation is within close proximity to sources. And so I'm not sure if there are any like long distance approaches that could be employed by satellite. I think it's a really good question, but certainly I'm not, not the expert in that area.
One thing that I recall is that I think there was a study, and I think it was from Harvard, and it wasn't satellite, but I think there are monitoring stations throughout the country, and I don't know how many, and that was looking at radiation, I believe. And then I think they found connection between if you're closer to places where fracking is happening or other oil and gas activities. So I believe so, but don't quote me on that, but something kind of comes to memory about that. So you might want to do a search on that. I think it was a Harvard study on radiation in the US in the air, something like that.
Okay. So Dr. Goobie, any good PM 2.5 particles?
That's a really interesting question. Thank you for that. In our research, the sea salt was an interesting PM 2.5 component, and in a couple of cases it did look like there was an association between higher sea salt and reduced mortality. That being said, it was a kind of variable effect, and it wasn't consistent across our cohorts, and there really hasn't been a lot of research in other areas into this. I would caution that these particles may be a carrier for other potentially harmful particles. So, you could have sea salt that is bound in the atmosphere to other particles that you could inhale in association with the sea salt. And so it's really important not to necessarily think about each of these in isolation, because they don't exist in isolation. There's, many thousands of different types of chemicals that are interacting in the atmosphere, and all of those interactions are very complex. So we can't say, I think, definitively one way or another whether there are beneficial PM 2.5 sources. But I would say that most of my research has indicated that sea salt is at least very unlikely to be harmful. I can hedge and say that.
Okay, we have a statement in the chat from Tish Odell, who says we're asking the wrong questions. We have volumes of data that shows pollution is killing all of us and the environment. The regulatory agencies have been around for over 50 years. Research the history of regulatory agencies. They were created by government and industry partnership. The agency is a buffer to send the people to, but once the bench issues the permit, the pollution is legalized. Millions of court cases where people have tried to fight in court. We need systemic change. Other countries like Ecuador are actually doing this with rights of nature. Highest court has recognized rights of nature and revoked permits for projects that could not be proven safe. Check out CELDEF, and I believe Tish is a major organizer with CELDEF and works with the rights of nature legislations that have been tried here in Ohio. We had one on the rights of Lake Erie, which passed in the community and that. So
yeah, can I just say something about that? Yeah. So I'm Bill Lyons, and along with Tish is also the CELDEF organizer and a board member also of the Ohio Community Rights Network that I'm president of. And we have tried to get ballot initiatives, and some of them have passed, but through Ohio, that recognizing a community bill of rights and rights of nature, because we feel, and it's gaining steam throughout the world, but the U.S. has been kind of backward on this, that if we give protection and rights to what sustains us, nature, then we can stop some of these crimes that have happened. Rather than us having to prove that something is harmful, they should have to prove that it's not. And the system is all backwards. And that book, Death by Democracy, tells the story of how we tried to use our so-called democracy, the different community rights groups throughout Ohio, and how all three branches of government have tried to stop us and put all kinds of roadblocks in our path of trying to do what we were trying to do with community rights and rights of nature.
Yes, and Brian Houlihan answers that with, as long as industry can buy politicians, they'll keep looking the other way on these issues. We have a question from Linda Brown. For Gillian, could you speak more about the differences in health policies in Canada and the United States and how those may affect health? Specifically, as an example, cystic fibrosis patients in Canada live 10 years longer than they do in the United States. What would you attribute such significant differences to? And a commonality one from Paul Warwick, who says, generally speaking, do you think Canada's government is more responsive to bad actor industries that pollute and contaminate, since it has to pay for the healthcare bills for the citizens who are affected? Do you have any thoughts about that? And if so, how does Canada's responsiveness to these things compare to the US?
Great questions. I like the example that was brought up by Linda about patients with cystic fibrosis, and that has remained true, that patients with CF in Canada tend to live quite a bit longer than patients in the US, and I do think that it's really an access to care issue, and having equitable access to care. We saw something. And I encourage you to go back and read that neighborhood disadvantage paper that we published, because there was a nuanced finding there that I didn't have time to present. But when we looked at baseline lung function in patients with fibrotic ILD, we found that higher disadvantage was associated with reduced baseline lung function at presentation for their ILD. So people were presenting with more severe disease, both in the US and the Canadian cohort. Okay, so disadvantage is still affecting people in Canada, and they're presenting with more severe disease. But when we follow them forward throughout the course of their disease, once they've actually reached diagnosis, the people in Canada were not as affected in terms of their mortality risk, whereas the people in the US were. And so to me, that indicates that, you know, having that access to specialist care, that equitable access to specialist care, even if you are among the most disadvantaged individuals, really makes a profound difference in your ability to respond to medical therapies for any disease. And I think that does highlight healthcare system access as being a really critical component to that. With regards to CF, and I think in fibrotic ILDs and many other chronic diseases that can be treated by transplantation. So in the case of CF and ILD, we're talking lung transplantation. Having equitable access to lung transplantation as a therapy is a huge thing. And the cost barriers to that are astronomical, especially for people that don't have adequate healthcare coverage in the US. There's a huge amount of person burden that's required, and there's a massive amount of cost burden there. And that's the same with any, chronic disease that requires frequent medical therapy. So I think that it's a really important thing to consider. And I think it's, frankly horrible that we would treat people differently with different therapies and different medical approaches based on how much money they have or their access to insurance. So I'm a huge proponent of at least some level of universal healthcare access for all. In terms of the Canadian government having awareness of the kind of intersectional relationship between healthcare costs and environmental exposures, I don't think that they're that advanced in that thinking process. I think that takes it to another level that is not frequently considered that in a way that it very much should be. And I think that we are trying to, both in the US and Canada, increase awareness at policy and regulatory levels about the really intersectional relationship between environmental risk factors and healthcare costs, because this is only going to be becoming a bigger and bigger issue over the next 20, 30, 40, 50 years, as we're seeing a lot more human health impacts from climate change. And I think that, just being an advocate for that, either as a community advocate or a professional advocate, is really important. But I wouldn't say that the Canadian government is particularly enlightened to a greater degree than the US government in that regard.
Okay, thank you. Bill Davis points out that we've hit on the need for move to amend, which is looking to end corporate rule and the money is not speech campaign, and getting the corporate money out of politics and stuff. And it hits on, and Gillian, you mentioned it too, the interconnection of these issues. No issue exists in a silo. And all of these issues are interrelated and have an effect on the other issue. And that's something that we need to do as a people, is to come together and treat these issues all together, because they all affect one another. We can get the best healthcare system in the world, but if we don't take care of the environment and we don't, talk about gun violence, and we don't talk about other issues, like poverty, and how that affects health, then we're not going to get any further than what we are and stuff. And I think it was something that came out of Canada, though. It was a study, and I did a brochure for SPAN on it about, does poverty affect health? And they discovered that poverty was as great an indicator of health as blood pressure and cholesterol levels and stuff. Absolutely. But we're not really dealing with that one. Although I was glad to see my new doctor's office has posters up, have you eaten today? Can you heat your house? Do you have a place to sleep tonight? And that. So, some of them are. But we have another question. Does contaminated air generally stay within a region, or does it eventually move to impact other regions?
Great question. So it definitely moves. There's, depending on what type of pollutant that you're dealing with, there's different dispersion characteristics of different types of pollution and interactions within the atmosphere. I'm not an atmospheric scientist, so I wouldn't venture to say that I can, describe that in detail, but it is very complex. But, long story short, we definitely do see that pollution produced in one area can move and impact other regions as well. When I was living in Pittsburgh in 2020, I think there was a huge amount of wildfires in the Pacific Northwest, and we were experiencing wildfire smoke in Pittsburgh, and that's, you can see the wildfire plumes as they traverse across the continent, and you can follow that. There's lots of great resources online that I don't have at the tip of my fingers, but you can follow those sorts of things. And another example, looking at our Canadian cohorts, we were most seeing highest levels of pollution in our sites in kind of Toronto and Hamilton, which are close to a lot of heavy environmental industrial pollution sources. There are industrial pollution sources in those regions in Ontario, but a lot of that industrial pollution is also coming from the US. So Canadians are not protected by our border when it comes to environmental sources of pollution as well. So it is important to consider that. And, unfortunately, the Canadian government doesn't have a lot of sway on the environmental pollution that comes from the US. So, we are all in this together, and we need to think more globally when we deal with these things.
Thank you. Tish O'Dell tells us we have a sick care system and not a healthcare system. Absolutely. The healthcare system works the same as the environmental regulatory system. And she suggests reading the book Inflamed by Dr. Rupa Marya and Raj Patel. And I got Rupa Marya was an excellent speaker. PNHP had her as a keynote a couple years ago via Zoom. And she really laid it out. And an unjust society is a very sick society. The more unjust your society, the more disease you're going to have. And a lot of this is, it's cultural and carried through the generations. I would highly recommend that. She was an excellent speaker.
I think we're at the 11:30 hour. So I think we should probably go ahead and let people go if they care to. Just riffing off of one thing that Gillian said before we closed, we've looked at chronic disease effects and likely mortality in people who then cross the line onto Medicare. And we clearly see when people get, into our universal coverage system for the elderly here in the US, that their health outcomes improve. So much like she was mentioning, that same sort of an effect across Canada as a whole with regard to cystic fibrosis. Many people probably with cystic fibrosis probably don't make it to Medicare until they're completely and totally disabled by their lung disease, and at which time they get to be on Medicare, which is about the point where you're talking about lung transplants again. So, and again, as Dr. Goobie pointed out, those are tremendous. That's the most expensive, complex stuff that we do in healthcare. It's a miracle when it works, but my goodness, it's high cost, high tech. It's a tightrope, and all these people have to be immune suppressed in order to tolerate their transplants, which puts them at risk for other infectious diseases. So very much want to thank Dr. Goobie and Bill Lyons for being part of our program today. We hope that our organization, having listened to you guys, is more sensitized to the issues of racism, poverty, environmental issues. And if we want to really have a healthcare system, we've got to start upstream at these things as much as we do give access to medical care, which is the downstream end. If we wait for everybody to get chronically ill, even if we have a wonderful healthcare system with universal access, we're still going to be a sicker and more expensive healthcare system. So thanks again to our two speakers. Any other final comments from either Matt or Deb?
Well, I just want to thank our speakers so much. It was very informative, awesome coverage, and thank everybody for coming to this. I think Deb had already put in the chat that there's going to be another talk coming up that you can link to and register for, talking about gun violence and how it affects our health as well. So